What are some good Botox alternatives? Because this is something that I get from so many people in my audience, whether they just don't want to keep doing Botox all the time, they can't afford it, they might be pregnant, they might be breastfeeding, they might just be taking a break, they don't want to do it yet. I mean, there are so many different reasons. And there are a lot of things that are touted as Botox alternatives. Some of them are, more efficacious than others, although there isn't really a true alternative. But from your experience, what is like the best thing that you can do to kind of hold off on that?
I don't think there's a single best thing, I'll tell you honestly. Whenever there's a desire in the marketplace, there pops up a whole lot of people who are very much willing to meet that desire. And whether that product that they're offering actually meets the desire or not, they don't really care sometimes. And so sometimes you have these products that tout, this is the alternative to Botox, and it's really not. I think that botulinum toxin in general is an incredible tool. I mean, we have 3,000 studies on botulinum toxin, whether it's therapeutic or cosmetic. So the safety and utility of the drug is really established very, very well. Other things that help with skin quality, so retinol, for example, is really nice. And I think it turns skin over really quite well. It helps with skin quality, with skin collagen content, with fine lines. So I think that's something that is very, very useful. And, when used regularly, I think it has a very good effect. There's procedures that we do like microneedling, like some of the microneedling with radio frequency. And those kinds of things do the same kind of thing. They make the skin, they increase the collagen content of the skin. They improve fine lines. They improve the texture of the skin. And I think that's really nice. And then, and then good products, like having a good sunscreen that you use on a regular basis, whether it's indoors or outdoors, you should have something on that works to protect your skin. And then, there's a bunch of other stuff. There's antioxidants and these kinds of products that I think the evidence for that is a little bit thinner, but I think that those could be also somewhat useful. I think anything that says this is an alternative to, this is like the topical alternative to Botox, or buy this and you won't have to do Botox, I think that's pretty reliably not true.
Yeah, so let's debate face tape, okay?
Oh my God. Okay, so I put up a post about that, but I actually don't think there's anything wrong with doing it at night, except, if whoever is next to you in the bed thinks it's kind of weird thing.
Yeah. So, I get a lot of pushback about this from doctors. You probably know my whole story. I had a horrible, horrible reaction to Botox, debilitating for months, couldn't function, tried a few units again once I got better, had a horrible reaction again. So it's off the table now. So I'm in a position that I never wanted to be in. And I've been looking for alternatives. So I came across face tape in desperation, not silicone tape. I want to make that clear. I tried that. That was horrible. But I always try to make it clear that I'm not comparing it as an equivalent to Botox. And it's not a panacea either. But for me, who I wake up like this, I am, I guess, expressive in my sleep. I never knew, because for 10 years I was completely frozen. And now I'll wake up with horizontal lines, and I sleep on my side. So I get lines on my side. So a few nights a week I'll do the tape and I wake up completely smooth. Is it going into my muscle and inhibiting movement 24/7? No. But if I have a podcast, or if I have a shoot or something or I just want to wake up smooth and try to kind of maintain that, it's been great for that. But there is only one that I like. I don't make any money from it, but adhesive wise, I've tried different ones, and some of the adhesives are so harsh, so harsh. So there's one that's extremely gentle. It works over my skincare. I can do everything, non-irritating. And for me, it's been a good, not alternative, but
it helps
option to help. Yes. Yeah.
No, because one of the main things about Botox, or whatever, any of the kinds of botulinum toxin that we have, is the preventative function, right? And the preventative function is just that it keeps you from, the less you do this kind of thing, the less these lines etch into the skin. Where at first, when you're younger, you're smooth when you're relaxed and you just make lines like this. But then as you get older, as you do this expression more and more, those lines etch into the skin. So even when you're relaxed, they're present. So we're trying to prevent that. I think this is this is reasonable. I think this is totally reasonable, because at night we we have dreams. We do make facial expressions. We're like terrified about whatever it is that we're dreaming about.
Yeah. Somebody said that if you tend to run anxious, you're more of a raiser. And if you tend to run a little like angry or something, or I don't know, you scowl. I don't really do that, but I guess that I raise my eyebrows. And I usually put it on after my boyfriend goes to bed, but he doesn't care anyway. It's like so benign. It's 3 little strips. But there's other things like silk pillowcases and things that like help to just not cause so much irritation and like smushing of my skin. I try to sleep on my back. I just can't. I would rather get 8 hours and be comfortable on my side than
I know. So my training is in ear, nose, and throat. So I used to be a head and neck surgeon, and so one of the things that we used to do is to tell people, because one of the things we used to do is for people that would come in with like heartburn or with postnasal drip, we'd tell them to, you have to sleep on your side. You can't sleep on your back. And they were like, well, it's hard to do that. So we tell them to take a tennis ball and sew it into their pajamas. So they'd have a tennis ball on their back. And so they wouldn't be able to rotate because it would be super uncomfortable. So, you don't want to do that. You're just going to...
That sounds horrible.
It's not.
No, I know that
great.
They have those pillows that you can lay there. And the only time I've ever slept on my back was when I got my boobs done. Then when I got my boobs out and when I had my nose done, I think whenever I absolutely had to.
Hard.
Yeah.
Totally.
Yeah.
So good. So those things are helpful. Is there like, papers in the New England Journal of Medicine talking about how silk pillows help with your lines?
Big
There's
silk
not.
And big tape aren't going to be funding.
But that's okay. These are not things that are like super risky interventions that you have to be careful about. But so I think it makes sense.
I mean, there's so many trends.
Yeah.
That I would understand being in your position, seeing a lot of this stuff and just being like, come on. I think that it also kind of depends on like who's posting it, what do they have to gain from it? I mean, there's a lot of...
For sure. I mean, I just saw a patient who came in actually last week and she had like sores on the, in the crow's feet area. And I'm like, what's going on? And on both sides. And, she was like, yeah, it's because of this tape that I'm using. And every time I take it off, it really like disturbs my skin. I'm like, yeah, you can't, that's the wrong kind of tape, clearly. So it's good that you found something that really works well.